Hi, I'm Dr. Laura Van Bryce, your host for the Chronic Fatigue and Fibromyalgia Summit, and today I'm interviewing Dr. Evan Hirsch. Dr. Evan, as he is affectionately known, is the best-selling author of Fix Your Fatigue, the four-step process to resolving chronic fatigue, achieving abundant energy, and reclaiming your life, and one of the nation's leaders on finding the root cause of chronic fatigue and resolving them. He suffered with chronic fatigue for 5 years before he achieved resolution using the Fix Your Fatigue program that he developed at the Hirsch Center for Integrative Medicine in Olympia, Washington. He has helped hundreds of people resolve their chronic fatigue and is on a mission to help 100,000 more through his blog, online courses, books, consult, and the training of providers. He has lectured nationally and internationally on topics in integrative and functional medicine and is board certified in family medicine and integrative medicine. When he's not at the office, you can find him singing musicals, playing basketball, traveling, dancing hip hop, and spending time with his wife and daughter. Welcome, Dr. Hirsch.
Thank you, Laura. Thanks for having me.
Wonderful. Well, tell us about Bartonella and its role in chronic fatigue.
Absolutely. So in my research, I have found that there are 14 causes of chronic fatigue. And one of those causes is infections. And within the infections, one of those is Bartonella. And I found that a lot of people have Bartonella, and it's playing a huge role in their chronic fatigue.
So what are the symptoms of Bartonella?
So Bartonella can cause many symptoms, and they're usually disparate, and people oftentimes don't put them together. But when they hear me talk about it, they point to that video and they say, that's what I have. So generally, people will have headaches, neck pain, body pain. So a lot of times there's muscle stuff happening, muscle cramps, muscle aches. There are sleep issues. Oftentimes people have a hard time falling asleep and staying asleep. There are symptoms of anxiety and depression. Autoimmune thyroid conditions is a major consequence of Bartonella. Sometimes people have lockjaw. They'll have small red dots on their bodies called hemangiomas, or cherry angiomas rather. Sometimes they'll have stretch marks, but they won't have undergone any sort of weight fluctuations. They'll just have stretch marks. Looks like maybe they had a big scratch on the back. Pain on the bottom of the feet, burning, soreness is a huge cause, or is a huge consequence of Bartonella. Those are the major symptoms associated with Bartonella.
Interesting. Just out of curiosity, what do the pain on the bottom of the feet you think have to do with Bartonella? Is there an explanation for that?
That's a very good question. So Bartonella loves ligaments and tendons. It loves collagen, and perhaps maybe that's why, but it also loves living in the nerves and living in the muscles. And so I'm not sure why the bottom of the feet, but that really is pathognomonic. If someone has burning on the bottom of their feet and they have headaches and sleep problems, it's most likely Bartonella.
Interesting. So how do people test for Bartonella?
So as I've just described, a lot of the symptoms, you put together this constellation of symptoms, and it's really pathognomonic or diagnostic for Bartonella. So you can, and according to the Centers for Disease Control, a lot of these infections really are clinical diagnoses. So they're based on the physician's knowledge or assumption based on a conglomeration of symptoms. So you can diagnose based off of symptoms, and I do that a lot. You can look at serologies, so that's looking at the immune system's reactivity to the infections, whether that's IgM or IgG reactivity. It's not a great test. Oftentimes it doesn't pick up Bartonella. And then there's PCR testing, or looking at the DNA of the bug. And the lab testing that I like to use is DNA connections. It's a urine test that looks at the PCR, but you do have to provocate it. So you do have to push out the Bartonella and these other infections. And you can do that by getting a really vigorous massage, running around the block, doing jumping jacks before you collect the urine in order to really flush out that lymph system.
So what is that exercise or stimulation? How does that cause the Bartonella to want to come out?
So as you know, a wonderful support for the lymph system is exercise. And a lot of these infections really like to live in the lymph, and Bartonella especially. Acute Bartonella is called cat scratch fever, and one of the things that happens with it is that you get very large lymph nodes close to where the cat scratched the person. And Bartonella just loves to live in the lymph system.
Got it. So my next question is, how are people exposed to Bartonella?
So 50% of all domestic animals have Bartonella, about 75% of all feral animals. And then it's also very commonly found in humans, just being transmitted sexually, vertically, from mother to child. There are just so many ways which people can acquire Bartonella that I found it to be, quite ubiquitous.
So it sounds like Bartonella is quite prevalent out there. Is that correct?
It is. There's not a lot of stats on exactly how prevalent, but I have found that it's probably upwards of 90%. I think that everybody probably has Bartonella, but their immune system keeps it in check. And I believe that also about a lot of other infections, is that we have this beautiful symbiosis that exists with a number of these infections, whether it's Borrelia, Bartonella, Babesia, Epstein-Barr, that they are present, but they are kept in check by the immune system. And it's only when the immune system gets dysfunctional from some sort of major stressor or a couple of major stressors that all of a sudden it cannot keep these bugs in check anymore, and the bugs become opportunistic and start causing problems.
So what are specifically some of the factors that would make one person express it and another person have it in control?
Very good question. So it really is what I call the usual suspects, which are heavy metals, heavy metal toxicity, chemical toxicity, mold exposure, mold toxicity, other infections. So other infections, emotions, negative emotions, chronic abuse, and then EMFs or electromagnetic frequencies. Pretty much anything that can distract the immune system, that can turn it on its head, upend it, pull it away from what it's supposed to be doing so that these infections can take hold. And that's generally the difference between somebody who has one of these infections and someone who doesn't.
Got it. So where does Bartonella live in the body, and what's the connection between Bartonella and the thyroid?
Mm-hmm.
And also Hashimoto's.
Mm-hmm. So Bartonella lives in the nerves and the muscles, which is why a lot of the symptoms happen there. It loves collagen, so it's going to be in the tendons and the ligaments and the skin. And it actually has a couple of different phases. It has a skin phase or a dermal phase where it's living in the skin, which is how you get those skin lesions that I talked about. And then it also lives in the endovasculature, so in the blood vessels, which obviously carries blood and consequently the Bartonella all over the body. And so oftentimes people can get vascular spasm, so that people who have Bartonella, they'll be really cold. Even if their thyroid is optimized and they're still cold, sometimes it's Bartonella. So that answers that first part of the question. And then the second part is the thyroid. For some reason, Bartonella also loves the thyroid. And I love to tell this story of what happened the first time that I started treating Bartonella. I gave somebody a therapy, and then I hear back from her the next day where she's kind of flipping out, she's got anxiety, her heart is racing. I bring her into the office, sit her down, and start asking her questions, and I can't really figure out exactly what's happening. It doesn't sound like die-off, I'm not really sure. And then I say, when was the last time you felt this way? And she said, when I had Graves. And I said, really? I said, so you're hyperthyroid. And so I started taking her down off of her thyroid. And I was able to remove her thyroid entirely over the course of several weeks. And so it seems like Bartonella is living in the thyroid gland, and that as I treat it, the thyroid comes back online, and I'm able to decrease the amount of thyroid that people need. And I find that about 70% or so of my patients who have Bartonella and Hashimoto's hypothyroidism can get off of their thyroid completely, about 70%. The rest may require some, but usually we can decrease the dose. And so I'm not entirely sure why that's happening or what that means, but it's been really serendipitous and something that I love talking about.
Interesting. So I'm curious, I often associate Bartonella or Babesia and things like that with Lyme disease, but we haven't mentioned Lyme here. Is Lyme associated with all this too?
Yes, and so, and thanks for bringing that up, because one thing that I forgot to mention when I talked about transmission was that Bartonella can be transmitted by ticks, fleas, chiggers, biting flies, mosquitoes, so pretty much anything that takes a blood meal. So oftentimes it's going to travel with infections that also are found in those hosts. So that includes Borrelia or Lyme, that includes Babesia. So oftentimes they will travel together. Not always, but sometimes. Like I said, somebody can get Bartonella from the scratch of a cat, or from sexual contact, or from their mother, vertically through the placenta. So it doesn't have to be, but oftentimes it's commonly found that way. And then something else interestingly happens is that they have this relationship where sometimes they're swapping DNA with each other when they're in the biofilm, when they're hiding, and you can get what I call Bartonesia, which is a combination of Bartonella,
And
Babesia,
Babesia.
and Borrelia. And so, sometimes you're getting these superbugs that can be very challenging to treat.
So how do you treat Bartonella or Babesia or Lyme or whatever?
So I'm a big fan of the Byron White formulas. I have very good success with them. And what they are is a combination of herbs that work on a number of different levels. So they are antimicrobial, they are immune modulating, and then they also work on the energetic level. They're all energetically tested. And so I just find that combination works really well, and the products are incredibly powerful. So oftentimes when people Google the formulas, they'll message me and say, hey, I don't really want to take this because it has a bunch of negative reviews online. And that's because, you have to start with one drop, and you have to make sure that you are providing die-off support from that first drop, because it is so potent. But consequently, because it is potent, it also works really well.
So tell us exactly what a die-off is, and how you treat it, and how you build up into more drops, I guess.
Mm-hmm. So a die-off reaction, or was commonly called a Hirsch-Herxheimer reaction, stemmed from some of the treatments that were being done probably 50 to 70 years ago on syphilis. So penicillin was being used to treat syphilis, and people were getting this die-off reaction, which was essentially a flu-type reaction where they would get fevers, chills, body aches. And so what we see now with some of these infections is that it's like you're turning up the dial on the problems and the symptoms that the infections are causing. And so the bugs will die, and they release their crap into the body, and the body reacts with what's called a cytokine reaction, different components of the immune system reacting. And you will experience worsening of a lot of your symptoms. So for example, with Bartonella, when I talked about the pain on the bottom of the feet, headache, neck pain, all of those things will get worse when you start killing Bartonella. So you have to support with some sort of die-off support. Now the die-off support generally opens up pathways in the kidney and the liver and the lymph to help get things out. It usually has binders in it to bind up the toxins that are being released by the infections, and has blood cleansers in it, like sarsaparilla. My favorite die-off support is also by Byron White Formulas, and it's called Detox One. And it works wonderfully. And I usually have to have it as a 2-to-1, 3-to-1, or even 4-to-1 ratio with the antimicrobial that I'm using. So for example, ABART, A-B-A-R-T, is the Byron White formula for treating Bartonella. And so let's say I do 1 drop of ABART, I'm going to do 2 drops of the Detox One. And if someone experiences die-off, then I keep increasing the Detox One until they no longer have the die-off. And that might be, maybe they're up to 4 drops to 1 drop of the ABART. And then in about a week, I increase then by 1 drop of the ABART, and then we go up to 8 drops of the Detox One, keeping that 4-to-1 ratio so that as the bugs are dying and they're releasing their stuff into the body is able to clear it appropriately utilizing that Detox One. And I generally like to increase by a drop a week, going up to about 15 or 30 drops, and holding there for a period of a minimum of 3 months, but generally it'll take 6, maybe 12 months with continuous improvement. So just a wonderful therapy that I can't recommend enough.
Well, great. Is there other things that you might want to talk about that I haven't asked you about?
I think that one of the things that's important to talk about is that if someone is not having success with treating Bartonella or any infection, they always have to look at the usual suspects. So heavy metals, chemicals, molds, infections, allergies, emotions, EMFs. One of those things might be providing a stumbling block to getting better. So because you have to have an intact immune system in order to get rid of Bartonella or any of these infections. And so that's why some of the research around mold is that if for people who had mold and Lyme, there was a small study that was done through real-time laboratories. They treated the mold and the Lyme went away. And I believe that's because the mold, by treating the mold, it freed up the immune system to turn around and say, hey, what are you doing here? And start going after the infection. So that's something that I can't emphasize enough, because I get a lot of people referred to me who have been treated for a lot of these infections and they're not better. And it's usually because there's something else that's been missed that has to be evaluated.
Can you tell us how someone would go about testing themselves for these other stumbling blocks that might keep them from getting better?
Absolutely, and I talk about this all in my book, Fix Your Fatigue, which is on Kindle right now, and the paperback should be coming out in the next month, where I give away all of my protocols and I talk about how people can find the labs that they need to assess these different things. So, you know, there's a lab, Doctor's Data, that I really like for the heavy metal testing, and Genova Diagnostics for chemicals, and real-time laboratories for mold. And a lot of these you can get through directlabs.com, mymdlab.com. So there's some of these online that you don't need a physician in order to get the labs done. And then once you get the lab, if you're able to interpret it, great. If you're not, then you may need to find a provider who can do that. But you can acquire a lot of data, and that's really what this is all about, is that figuring out those 14 causes, which causes you have, because everybody has multiple causes. You just have to figure out which causes you have, and then have to figure out how to remove those causes one at a time, what the best order is for doing so, and then, you know, people are going to find success.
Great. So is there more that you can tell us about your book?
Sure. So I've tried to make my book as user-friendly as possible. I know a lot of people out there have chronic fatigue. They have brain fog. I had chronic fatigue. I totally get it. I tried to outline things as much as possible. And at the end of every chapter, I have a summary section. I have a plan section. I have an action steps section. I have a Facebook group. Fix Your Fatigue Facebook group so people can go and get support. So I'm on a mission to help 100,000 people resolve their chronic fatigue. And I'm just trying to get the word out there as much as possible. So some people might be helped just with the book. Some people will be helped with the online classes. Some people will need to see me or someone like you for one-on-one consulting. So I think there's all sorts of different ways that people can get help. So it really depends on, what their budget is, what their needs are, how much they're able to do on their own.
Great. Well, I think that's a wonderful mission.
Thank you.
And can you tell us about your free gift?
Absolutely. So on my website is my chapter on sleep. So it goes all into all of the challenges that people have with sleep and how to fix it. And the surprising thing about sleep is that I actually get more people to sleep by giving them things in the morning than I do by giving them anything at night. And that's because oftentimes sleep is a circadian rhythm problem where the body is confused about what is sleep, what is wake. And if we can make the body more awake during the day, oftentimes it helps figure out the sleep problem at night. And then of course, if that's not working, going into things like Bartonella and Babesia to help fix some of the sleep issues that are such a problem with chronic fatigue.
Great. Can you tell me some of the things that you use in the morning for sleep?
Absolutely. So B12, iron, adrenal support, thyroid support, those are really the big things, and sometimes all it takes is adrenals and B12, if someone doesn't have a thyroid issue. And then, and I also find that adrenal support really needs to be given every 3 hours or so. So you wake up, let's say 7, 8 o'clock, then 3 o'clock, then 2 o'clock, but you have to stop taking it by 4 o'clock, because then after 4 o'clock, all of a sudden it starts messing with your sleep. But if you can supersize the adrenal support, B12, thyroid, iron in the mornings, it can make a huge difference with people's sleep at night.
All right. Well, thank you so much. I am definitely going to check your book out. And thank you very much.
Thank you, Laura.
I also want to thank you all for being part of the Chronic Fatigue and Fibromyalgia Summit. And make sure you come back for our next exciting interview.